John. Good to see you. What do you have here? Hamburgers?
Let's go home.
I'm going down here.
You're making a fool of yourself.
What do you want?
Here, give me this. You've had enough of this, okay?
I've had enough of nothing.
Will you just settle down?
I think they need a little help over there.
It's done it.
Excuse me? Excuse me? You're never gonna cook that with that flame. I think you need more juice.
Stop! Don't run! Drop on the ground! Drop on the ground!
Is that John?
Roll! Roll, John! Roll! Roll!
Burns are frequently a result of careless behavior and can cause severe injury and even death. The severity of burns depends on their depth, size, and location. In this unit, you will learn how to care for different types and degrees of burns. By knowing what to do, you may be able to help prevent a burn from becoming a life-threatening injury. 3 principles to follow when caring for burns are: prevent shock, reduce pain, and prevent infection. The severity of a burn depends on its depth or degree, size, and location. Critical areas are the face and neck, hands, feet, and genitals. Burns are also more serious when they are spread over large areas of the body or combined with other injuries. Burns are often classified by their depth or degree: first, second, and third. First-degree burns are the least severe. The signs and symptoms are redness, mild swelling, and pain. Second-degree burns are deeper, with redness, severe pain, and blisters. Blisters may be open or closed. Third-degree burns are the most severe. The burned area may look white or charred. The victim may have either severe pain or little pain.
Look at this studio filled with glamorous merchandise, fabulous and exciting bonus prizes, including this. Experience the sporty, stylish.
Have you seen my purse, honey?
Yeah, it's right out here. Ah!
To treat a first or second-degree burn with no open blisters, flush the area with cool running water. This reduces swelling and pain and prevents further damage to the skin.
Honey, bring the first aid kit in.
Okay.
Then apply a moist dressing and bandage loosely. To care for a third-degree burn or a second-degree burn with open blisters, cover the burn with dry, sterile dressings. Bandage the burned area loosely. This helps prevent infection and reduces the loss of body fluids from the burned area. Do not use water on a third-degree heat burn because it increases the risk of shock. Bandage the burned area completely.
Morning, Lucille. Keeping busy.
Busy as usual.
That's great. Come with me.
I'll call an ambulance.
Hold this down. Help me get your clothes off.
A chemical burn is dangerous because a chemical keeps burning for as long as it is in contact with the skin. Call EMS immediately. Use lots of running water to flush all of the chemical from the skin. Remove all affected clothing and jewelry. Continue to flush a chemical burn for 15 to 30 minutes. If chemicals get into an eye, flush the chemicals out with lukewarm water. Position the victim's head so the injured eye is lower than the healthy eye. Run water from the nose outward.
An ambulance is on the way.
Cover chemical burns with dry, loose dressings. Continue to monitor the victim's ABCs and care for shock. To review, Care for burns by preventing shock, reducing pain, and preventing infection. Care for first-degree burns and second-degree burns that have closed blisters with cool water. Apply moist, sterile dressings and bandage loosely. To care for third-degree burns or second-degree burns with open blisters, apply dry, sterile dressings and bandage loosely. To care for chemical burns, flush the burn for 15 to 30 minutes. Cover the area with dry, sterile dressings and bandage loosely. In every case, care for shock, monitor the ABCs, and reassure the victim until trained medical professionals arrive and take over.